The following program is sponsored by The Greek, Ely's Radio Shack dealer at 570 Altman in downtown Ely, and brought to you as a public service by Georgetown Media in Ely, Nevada. Special White Pine County Commission and Board of Health and Special Joint County Commission and Fire Commission meeting, April 7th, 2021.
Regular special county commission meeting on the Board of Public Health and Joint County Commission meeting and Fire Commission meeting. On this Wednesday, April 7th. Would you all please stand and join us in the pledge? And Elizabeth, why don't you lead us today?
Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, as is normal, we'll take this first moment before opening for meditation, prayer, whatever you'd like. So take the first moment for that. Okay, we'll open the meeting right now, and the first item on the meeting is public comment. Is there any public comment on the phone? No, sir. Seeing none, okay. Anyone in the audience that wants to speak to public comment? Anyone? Come forward, state your name, please.
Good morning, everyone. Kyle Horvath, Director of Tourism, for the record. Making a public comment regarding item C4 on the agenda, and that is consideration for letter of support for the Ward Mountain Trail Expansion Plan submitted to SNPLMA by our Forest Service Division. I want to thank Commissioner Bullis for putting this on and everybody for considering this. I want to make 2 points. The first is that in the SNPLMA money, there are multiple pools of money. The Forest Service and land managers apply for a different pool of money than the county commission and the cities do. So this is in no way competition for the priorities that you guys set for your SNPLMA projects. This is coming out of a completely different pool of money. But the importance of this project is more than just a recreation project. It's an economic development project that has been in the works for 10 years, long before I even got here. Worked on by your neighbors and friends and people in the community to create a quality of life for locals, as well as a tourism draw in outdoor recreation and trails. This proposal through the Forest Service addresses trailhead development, which right now is a need. It addresses access points, which removes issues with landowners adjacent to recreation areas. It gets people off of the roads so that there's a safety issue going on, and it increases our trail system so that we become, very attractive to people looking at this as a destination, but even more attractive to people who run, bike, and hike with their families to be a place where they would want to move and live. And the last 2 years of putting the emphasis on mountain biking and trails recreation, we have since been named Mountain Biking's next big boomtown by Beta MTB, that's the former Bike magazine. So from an industry standpoint, all eyes are on White Pine County and Ely and our trails and our trail development. This project has not been recommended for funding twice through the SNPLMA project, and so what we're asking is the county modify the letter that was submitted just as a draft to address the economic impact of this project and support it in hopes that either they'll change their minds, or if it needs to be resubmitted in 19, there'll be a lot of understanding of why this project is extremely important for our businesses and for our locals, as well as our tourism. So, thank you.
Thank you. Anyone else from the public want to speak? There's no one on the phone right now? Okay, George?
Thank you, Mr. Chairman. Mr. Chairman, I want to remind you, per Governor Sisolak's Directive 024, Section 5, which states individuals not exempted by this directive or guidance issued by the Nevada Health Response shall be required to cover their nose and mouth with masks or face covering when in public space, so on and so forth. Commissioner Bullis, now numerous of you others are not wearing masks. It's a directive. It's a health issue. You took an oath to enforce the law, and now you're ignoring it. That doesn't set a good precedence for those of us in business that are trying to comply. It puts a lot of pressure. Well, the commission doesn't care. Well, they're going to take care of it. No, you're not. There's some hardships out there, my friend. And until the law is changed or the directive is changed, you need to abide by it. Mr. Chairman, I reported earlier in regards to a concern that I had that the golf course has used over 111 million gallons of water. I want to know if they paid for it and what you paid, if you paid. Mr. Chairman, I want to bring forth another consideration. I've asked you in the past to consider soliciting a newspaper that's fair and balanced. I want to remind you that last year, April 7th, 2020, I paid for ads, paid cash. You have yet to run. That's fraud. You need to pull their license. You've got to stop doing business with them until they rectify the situation. Mr. Chairman, today I have not received your written statements regarding the numerous concerns that have brought before you and the County Commission for the past several months, possibly a year now. I deserve more than a cold shoulder. I want equal protection under the law. Mr. Chairman, on your agenda item D5, you approved proposed County Commission meeting for closed personnel session. I did not see the building inspector, Brad Christensen, on the list. I remind you that there is and has been selective enforcement of the law under color of law. I have yet to receive proper repairs to my building at 570 Altman. When I complained, he stated that I hired a poor contractor. I remind you, I didn't give that contractor a license. You folks did. I'm forced to buy a permit for protection, and I didn't get it. Your inspector should have stopped the job and required correction to be made. He approved the job, and I continue to suffer. At a city council meeting, he told me to F you, you F&P, and after a following city council meeting, his wife called me and ain't no opening. I want equal protection under the law. You have personnel policy that's not being adhered to. You're not going to treat the public, let alone me, like that. You have a responsibility as a whole, and you're not taking care of business. I don't think it's funny, Mr. Chairman. Not funny at all. Mr. Chairman, I want to remind you that the Planning Commission does not address code violations by themselves as well as other members of the Commission or the City Council.
Your 3 minutes are up, George.
I'll be back.
Okay, thank you.
I want some answers, Mr. Chairman. How long do I have to wait? I'm already getting Social Security.
Thank you, George. Okay. At this point, is there any other public comment either in the building or on the phone? Last call. Hearing none and seeing none, we're going to move on, and the first thing we'll do is recess the regular county commission meeting for a special White Pine County Board of Public Health meeting. On page 2, item A, the first thing we have on that is public comment. Is the public health board meeting, is there any public comment?
I don't have public comment. Shouldn't I be running it?
Pardon?
Shouldn't I be running it?
Yeah, you're right.
Yeah, I apologize. Not,
Okay, yeah.
just trying to make y'all,
You want
any public comment with public health on the phone or on the, in person? Seeing none, I suggest we move on. I call the meeting to order. First item of discussion, I'm gonna turn some time over to our district attorney. It's my understanding he has written a plan for mitigation efforts moving forward. I wanted to, for the record, make it noted I was not consulted on this plan, nor was any of my input put into this plan. So this is his plan, not my plan. Just want to make sure you guys know that. Not that there's, not trying to sway your vote either way, by the way. Let's hear what you've got to say, and then we can talk.
And for the record, we have copies in the back of the mitigation plan. So this was, I'm not a public health officer, and I did this at the direction and consultation with our emergency manager, Brett North, and Travis Godon.
James, would you put your mask down?
Yeah,
There.
and Travis Godon. So essentially what we have is the state put out a document outlining what they were looking for when looking at turning control, delegated control back to the counties of this mitigation plan. So I basically followed that outline. Some of the areas where I deviated from that outline is in the preface. You can see the preface is basically, that's not required, so any, if the commission wants to adopt this plan, they can do it with amendments in any manner, but especially the preface is not required to be there. So if there's anything that anybody doesn't like in that, we can definitely change that. This is basically just our rationale for our plan. Then we have monitoring. Those different sections of monitoring are in the state's direction, their template essentially. So some of it doesn't look like monitoring, such as the White Pine County will cooperate with William J. Hospital. It will convene a special meeting if the hospital's ICU bed capacity reaches 80%. That was done in consultation with Matt Walker. He thought that was a reasonable number, and he does not foresee that number being reached. So that's just an example of, that doesn't sound like monitoring, but that's where it was in the template, so that's where I put it in our plan. Basically, we're not changing the monitoring. You know, the White Pine County or the William B. Rary Hospital does their monitoring. The Public Health Office does their monitoring. We're not trying. What I'm saying is, we're not trying to interfere with or reduce or do anything with monitoring overall. Mitigation measures. This is the big meat of it. And you can see there, it says, essentially we're going, what we're proposing is going full open, no restrictions. And that's what it says in a nutshell. While White Pine County understands, and parentheses, but respectfully does not endorse, that some industries and organizations will have restrictions and mandates prescribed by entities outside of the county. White Pine County will issue no restrictions or mandates. White Pine County will likewise not impose a mask mandate. White Pine County encourages each business or organization to determine for themselves what, if any, restrictions, rules, and or mandates shall be in place. So essentially giving the power back to each individual business to run the business the way they want to run the business, which is always the right of businesses. And then the second paragraph of that just is who it applies to. So in their template, they had, as you can see, many different sections, classifications of businesses. Since this plan contemplates applying the same standard to everybody across the board, rather than repeating that first paragraph 90 times for each type of business, I just said this applies to all of these businesses or organizations. The enforcement measures, we don't think that's applicable given what our mitigation measures are. So, and again, any of this that anybody wants to change, they can feel free to make a motion with amendments and I will change it. Public information, the county specifically hasn't, to my knowledge, had a big part of that outside of the public health officer and the public health office. William and Ryrie has been doing their own public information campaigns, and again, it says basically you don't want to interfere with any of that. Anything that's already going on can continue to go on. Resource needs, and this is in consultation with Matt Walker. it is my belief, but again, we can do amendments if this is not the case. But in consultation with Matt Walker, that we're pretty set on PPE and our resource needs. And then an amended plan, this was actually not in the template to have a section for the amended plan, but it was a recommendation for, Brett North has a contact in the state regarding this, and she suggested that we have something in there to show what happens if things turn bad again. And so this is, again, off of Matt Walker's suggestion, is that 80% ICU bed capacity will trigger a special meeting. We're not saying, we're not binding the county commission to say they will impose X, Y, and Z measures. It's just, we'll have a meeting, we'll discuss what's going on, we'll discuss what, if anything, we want to do about it, and that's what that is. Endorsements, the Board of Public Health is a required endorsement. The public health officer is not a required endorsement, but it is on there if the board wishes. Superintendent of White Pine County School District is a required endorsement, and I have contacted Adam Young, spoken with him about it, given him the details of the plan, what I'm looking for, and he has emailed me back saying that he will absolutely endorse this. The Nevada Rural Hospital Association or the Nevada Hospital Association is a required endorsement, one of those two. I've not been able to get in contact with anybody from there, so I was hoping that Brett could, is he here? There you are. I was hoping, Brett, with your contact with the state, if you could figure out who we need to get in contact with to sign this for the Nevada Rural Hospital Association.
Matt Walker also knows Brett. You can kind of talk with him.
And then, obviously, the White Pine County Commission is a required endorsement. So, that is the state. I'll take any questions if anybody has any.
That's fantastic.
I have a question. Between the section on monitoring and then the section on resource needs, I'm not sure I understand what the terminology, the sentence means when you said we do not have additional needs for public health enforcement or emergency management at this time.
So in that section in the template, that's what they say to put in resource needs. They said, identify any needs that you have for, and it outlines that exactly, public health, enforcement, or emergency management, meaning above and beyond what we're able to provide. What do we need from the state?
Okay, so, all right, because I was thinking we still need public health, we still need emergency management.
Oh, for sure.
In order to do monitoring, that
Yeah.
is
So
on
our,
the front, so,
essentially what that is saying is White Pine County, and if this is not the case, and certainly we can change it, but it was my belief at the time of writing this, that White Pine County is able to manage this on their own without additional resources from the state above and beyond what our just normal operating, budgets are and what we're able to procure PPE wise and all that.
so will that help with public health where we have a new individual that has been hired to help with the data entry?
Yeah, I mean, that's us taking care of the
I
problem
didn't
ourselves.
want to ruin the funding.
It says additional in the sentence, so it's not saying we're scrapping.
Well,
Right, it's basically what they're, so I can't read the mind of the people who put together the template, but I try to infer what they're wanting when they have these things out there. So if, for example, we said, hey, we need an additional, $1 million in funding so we can procure the PPE we need and the COVID tests that we need because we don't have enough, I would imagine they would come back and say, and again, this part wasn't in the plan, this is kind of inference. I would imagine they would say something like, great, we'll see what we can do to help you out. Here's a bunch of strings attached to this
see, and
assistance.
and there's an $80,000 grant out there from the state that I think that we have not received yet. So I was concerned that I didn't want any impact to that.
Have we applied for that grant yet?
Yes, we have.
Yes.
I'm actually doing the sub-recepting questionnaire right now, and I'll have the signature pages this afternoon.
Okay. So you
I'm
could
okay.
potentially
I don't know
identify,
if we're okay, though, if this will,
You feel like that has any
impact on?
I don't know, if you guys want me to step out and call Renee, I will happily go do that, to find out.
That was one of the biggest, because that's $80,000.
It is, it's not just for the staff, but it's also for a lot of equipment for the county as well, for future pods and everything. There is quite a bit in this grant.
You know,
No, it's just,
itching to get along with this, but I don't want, you know.
so what we could do is identify that grant, say, White Pine County is currently applying for this grant, we'll have the name of it in there, which is going to meet certain needs, and if Desi could give me a description, I can just plug that information in there, and then say, outside of that grant, White Pine County has no additional needs.
Okay, and that would be fine with me. And Mr. Beecher and I had conversations. I was concerned about any liability. And I think where things have been opened up, that anybody who was, and this was the conversation before, we had a meeting on the 23rd, and then the 24th, the hospital had opened up, and everything had opened up so far as anyone who pretty much wants to get a vaccine can have that vaccine.
Yeah.
So I am much more comfortable in this than I was initially.
And that's part of the preface is on March 24th, as many of you may know, William B. Ryrie opened up vaccines to anybody 18 and over. So right now, if you're an adult, you want a vaccine, you can get it. It's been that way for almost a week and a half, almost 2 weeks now. So, yeah.
I have a discussion point, we're having a discussion at this point. I don't agree with the 80% capacity of ICU. And the reason I don't, I work at the hospital in addition to being the public health officer, there's one ICU bed. If we have one ICU bed full, that's 100% capacity and the horses have already left the barn per se. I would feel much more comfortable with this plan if we continue to use the state's monitoring plan where they flag the counties for increased transmission, testing, and deaths, which we have not been flagged for weeks. I think that would be a much better indication of when we need to pull the trigger and stop as a commission and say, hey, it's time to reconvene, let's figure it out. I applaud this plan that our district attorney has put basically back on the people. We've taught the people correct principles, now it's time for them to govern themselves, is essentially what he's telling us right here, which I wholeheartedly agree. I'm just saying, if we use ICU beds to capacity at 80%, by the time it hits that, we, as a public health commission, might have missed our opportunities to reduce transmission and spread, because it's so specific with our hospital being so small. If we had 100 beds and 80% capacity, okay, maybe, but again, where we only have one, that's really hard to do. So I love the state's data matrix, you've all seen it. It's very simple to read. It doesn't cost us anything as a county. They take and track everything. I'm just suggesting we amend it to say, let's add our, instead of 80%, let's just say if we are flagged and we can use all 3 areas if you want, or 2 out of the 3, because that's what the counties or the state does now. 2 out of 3 areas. Again, our county hasn't been flagged in any areas for weeks now. So I don't feel like it's going to change the plan all that much, but it will hopefully catch an outbreak or a new outbreak before it gets to the point our hospital is at too much capacity.
Okay.
So I can entertain that as well.
I have no dog in this fight. Like I said, I'm not an expert. I called the hospital CEO, asked what would a reasonable trigger be. That's the answer that I received. So that sounds fine to me if you want to amend it to that. I didn't ask him specifically how many ICU beds there were, so I don't know. But if we want to add Mr. Coons' trigger, then I would just ask that you send me some language on that. I'll put it in there if the commission wants to add that instead of the 80% ICU. I just think that we need something to trigger us to do something to have a shot at them approving this plan. And obviously, if they don't approve this plan, we'll have other considerations, but Travis.
So, I mean, we can scratch ICU and just put bed. My issue with going with anything with the state is the target always moves. And we've seen that from like over a year ago. If they change the 3 measuring things, And then they put, so I just want something that's materially, you can go look at and say, I know that, you know, not,
of hospital capacity?
that's, you know, I think that's where we need it, because otherwise, you know, I don't trust the state government at all, but I'm sorry, that's just me, so I don't know what they're gonna say or come out or do, or what, you know, their next thing's gonna be, so I think we need something where ourselves and the public can say there's a problem here and not feel like, you know, 1984.
And with that, Commissioner Goodall, I don't know how to measure it other than what the matrices they're using in the state. Because the fact that they're already, I didn't want to have to reinvent the wheel, that's why I pointed to those 3 measures that they're already doing. I personally haven't seen those demographics change or goals that they're holding us accountable to. You might have other knowledge that I don't. I'm just saying, that's an easy, I could pull it up on that TV screen right now and show you where we're at. You know what I mean, it's that fast, and at any time, you as a commission can pull it up and go, oh yeah, we're fine, let's keep going. I think we need to open, I'm for opening, I'm excited to open, I think our public is desperate to open. And I applaud this major, I think it's a great thing, I just want a little piece in there to say, we're gonna be very careful and measure, because I too worry about the state coming back and saying, yeah, this is too loosey-goosey, you need to come up with a better plan.
If they do, we'll just pass a resolution and say, we're doing it our way.
I mean, I agree with Mr. Goals, if that's not politically correct or whatever, and I don't mean no disrespect to anybody, but I've had it with this, and, you know, like I say, unless it's something physical, I just don't trust setting it to any standard, because, or those measures, because they always change, or...
Well, they're incorrect, they're just weird, like, their measurement, by their bizarre off-statistical data, they've been showing people outside of our county that we have like 700 deaths or something stupid like that. I don't remember what the number was, but they were basing it off of per 100,000, which we don't even have in the county, and that's a completely incorrect statistical analysis. It's stupid.
Well, it is correct, Commissioner Bullis, in that they're trying to show how we compare to a bigger county, and a bigger county compares to a smaller county. They use that per 100,000 so that numbers correlate, right? We've had 6 deaths in our county, and they put that out per 100,000 so that we know, okay, is it as bad as Clark County, or is it better than Clark County? And so they're statistically sound, so I disagree with that statement. But if you want something of our own measurement, I say we strike 80%. The hospital has 4 COVID beds, maybe that's what the hospital CEO is talking about. There's 4 COVID beds in our COVID unit. I would suggest we say 3 out of the 4 beds are filled. We have it reconvene a meeting and see if we can find a pattern of transmission. That would be our own measurement. So I think that would satisfy both Commissioner Bullis and Godone. And that would make them happier, make me happier, because 80%, that's a hard number when it's at 3, I mean, that's 4.
Yeah, I get it.
Okay, but we should say 3 out of 4 then. If you want to do that, I would yield and be happy with that.
I can do that.
We also wouldn't want to prevent them from adding beds. The reason why it was a percentage is because if they change the number of beds that they assign to that, and say now we have 8 and we've said 3, now they're at 40% capacity and we're triggering a meeting. So yeah, getting back to your point, I think, Mr. Bullis, if I can be so bold as to say, he said the numbers were correct. They're weird because when you get to such different population levels, like with 1 bed you go from 0 to 100, it's not reflective of reality. When you have a population of 10,000, comparing it per capita to a population of 700,000 or 2 million down in Vegas, you're looking at 1 family getting infected, making it look like a similar situation as a super spreader event down on the Strip in Vegas. So those aren't equivalent. When you have such differences in base numbers, doing it per capita is not. I mean, you have so many standards of deviation away from the different population centers. Yeah, it is of limited use to use the per capita number, I would agree, but.
The average American has one breast and one testicle.
Can we just
So-
call this, can we just refer to it as the hospital's COVID section or department?
We'll just say 80% COVID bed.
Of COVID capacity?
I'd say 75 though, I'd go 75, there's 3 out of 4.
5%.
I know you're splitting it.
That way, we see it no matter how many beds.
Okay.
Sheriff,
So-
Sheriff has something to say.
Just